Good afternoon to you, first of all.
To you.
So before we start with anything, I would like to know your name as well as it's been how many years you are practicing, where are you practicing it? So what do you?
I'm Dr. Subodh Shivde and I'm practicing in Pune and I'm practicing for last 30 years as a urologist.
30 years is a long journey. So today we're going to be talking about kidney stone management. So firstly, I would like to ask, why do you think the number of cases for kidney stone are on the rise?
So one of the problems is our lifestyle has changed a lot. We are in a go or all the time moving, thinking that we are achieving some goal, work related, life related, and we just forget the fact that we have to hydrate our own body. The cells dehydrate themselves, the kidneys don't produce so much of water, and we'll end up with stones due to our pre-existing kidney stone tendencies, which are genetic basically.
Okay, heading towards the next one. What has been the most challenging case of kidney stone that you have dealt with, and how did you remove patient stone?
So these days the fashion or trend is to remove kidney stones by minimally invasive techniques, which means you do not cut them open but make a small hole, drill a hole into the kidney with the help of scope, go inside. Sometimes we use natural openings to go from the bladder into the kidney. We pulverize or make the stone small into tiny pieces or dust, sometimes with laser, sometimes with pneumatic devices, and then the small pieces are brought out. And asking about the challenging case, I happened to do it just 2 days back before I started for Indore, where actually during the operation one of the stones went out of the kidney, and I thought it was the most challenging moment for me because I had to go out through a small opening which was made and remove the stone. So I thought it was pretty stressful and challenging.
That totally was. Okay, so heading towards the next one. In your experience, what precaution can effectively be taken by the patient to avoid getting kidney stone, or if they have had it, to not getting recurrent stone?
So the simplest and the most essential advice I'll say is they have to hydrate themselves well. Those who drink 2 liters should drink 3 liters. Those who drink 3 liters and still get stones have to drink more, because that's a simple, most effective prevention. The stones would not then grow into bigger pieces and block the kidney, and the stone passages when are not smooth, they cause pain, they cause infection, and they'll have more trouble.
Okay.
It's the most essential advice I would like to give.
Okay. Lastly, what do you think is going to be the next breakthrough in kidney stone domain?
I think the breakthrough is not seen round the corner. We need to work on the basic tendencies why the stones form, which means we may have to think of medicines which work before the stones form, or we may be thinking of some basic biomolecular research where the genetic tendencies are curbed. So I think we have just got better in terms of removal of stone and possibly breaking them. I think the prevention would only come through lifestyle management, diet changes, and possibly being aware about these tendencies and seeing a regular expert who would then guide about prevention.
Okay, lastly, any message for all the upcoming urologists?
Yeah, I think all the upcoming urologists are so bright and smart that I do not need to coach them. But I just feel they should remember one thing: they should have empathy for their patient, their pain and suffering, because behind that is a person, a family who get anxious. So I think that's the most valuable tool they could use all their life, whatever the problem, be it stone disease or any other problem.
Well, that's all. Thank you very much for your time. Have a great time ahead.